Hi, my name's Peggy Hughes, and I'm a nurse here at UCSF, Mount Zion Medical Center. I have actually been here over 30 years working at UC, and I have been the clinical coordinator for the breast service and the plastic reconstructive service for about the last 10 years. It's a unique opportunity that UCSF peri-op offers surgeons here at UC because not every hospital setting has sort of a clinical expert in a given field, so we're very fortunate here. Predominantly Endomag for both the mag seed and the mag trace has really enriched our program here at UC because historically with the mag seed we had used the wires for our partial mastectomies. And this allows us not to be tied to mammography and having patients going down to mammography and having their wires placed. Sometimes 2 or 3 wires, it becomes difficult and it delays the OR. And the beauty of having a seed placed is it could be done up to a month before the surgery, depending on the convenience of a patient coming in and having a seed placed or having the morning of. And so we don't have these delays anymore. I think it's probably a little bit more comfortable for the patient, also a little less traumatic for them. With mag trace, it's nice because historically we have been using the nuclear med injections, I think specifically the technetium. So we've been tied to our nuclear med department, and they have to come over to Mount Zion. They are not located here on this campus. And they would have to inject the patients. And the injections could be a little bit painful for the patients. So by injecting the mag trace, the patients are asleep in the OR. They're injected. It's done by the surgeons. The other beauty of the mag trace is we no longer are disposing of nuclear waste. So it's a much greener initiative. And for me, that was really important. So the beauty of having both mag trace and mag seed is we're now disconnected with mammography and our nuclear med department. So patients with the mag trace are injected in the OR, and with the mag seed, the seed is placed prior to their scheduled surgery the majority of the time. And so we no longer have the delays that we used to. The other way that it's really enhanced our OR schedule is, at least here at UC Mount Zion, we tend to move patients around from OR room to OR room depending on the schedule, and if other OR rooms finish up earlier, we try and jump ahead depending on the convenience for the surgeon. And historically in the past, that's never been an option. And now we can. And so our surgeons love it, the staff like it, it avoids delays. There's also less questions from staff. Has the patient been injected, or has the wire been placed? We know it's been done. We could go in, we could look at the documented schedule, and we've got dates and times of when the patient is scheduled to have this done, and we no longer have a question about it. So that's been very convenient.